Everybody. This is Deneen Diamond from the Center of Excellence for Health. We are so excited to have you back and for our Long-Term Care Week 2024. It is Valentine's Day. I am wearing the part. I have my Valentine's pin, and of course, my logo always matches the heart for health and social care. So we have all kinds of different sessions for you this week, and today I'm very excited to tell you that our afternoon session is with Morgan Lambert. And Morgan has been working at Shannex for 8 years, she just let me know, and she loves working for the Shannex family. And Morgan also let me know, and I'm totally ad-libbing this, Morgan, because I'm not going by your bio, is that she's had many different positions at the Shannex facilities. And she's going to dive into some of the careers that she's had over the last 8 years and talk a little bit about what her career pathway looks like and what it has entailed. So without further ado, I am handing it over to our afternoon expert, Morgan Lambert.
Perfect. Thanks, Deneen. Hi, everyone. I'm super excited to be here today, especially to shed some light into the healthcare facility to answer any questions that you guys might have. So I'm going to discuss the rehabilitation role that I have been in for a good chunk of my Shannex career. But with that being said, I've been in a couple different roles, and I will mention those throughout the PowerPoint today. So even if the questions are pertaining to any of the other ones, I open and welcome any questions that could arise from that. So I will get started. All right, so first thing we're going to talk about is just about me. So about me as a person, a little bit about my background. We'll dive into personal skills as well as my career portfolio, training and education that is required for my position, as well as work experience and some career advice. So a little bit about me. When I was younger, I actually always wanted to be a nurse or an LPN. I had a lot of nurses around me and my family. My mom's actually an LPN. She currently works at hospice. So another career path kind of never came to my mind. And my mom was my career mentor. So she's an LPN as well. And she definitely helped with my decision to become an LPN. Growing up with a lot of people that are in the healthcare background, it was just something I always had a passion for. I volunteered a lot in the nursing home she worked in when I was in high school, and that's kind of where I really found my passion. So some personal skills and a little bit about me. So I'm originally from Boys Town. A lot of people don't know where that is. I always say if you're driving from Fredericton to Miramichi, it's the little pit stop on the way that it has one Irving, and if you blink, you could miss it. So not from a very big town. But in my spare time, I do spend a lot of it over there, especially during the summer. We actually have a camper over there on the Miramichi River. So I love to camp. I love the outdoors, going out on the side-by-side during the summer. I do a lot of river runs, that type of thing. My greatest achievement, I would say, is definitely my daughter in my career. So I actually graduated from my LPN in June of 2017 and became a mom in August of 2017. So 2017 was kind of a banner year for me. Becoming a mother and also taking on a new career around the same time was definitely difficult, but probably one of the most rewarding things. I'm outgoing, I'm organized, I'm very personable, and I feel like in healthcare, multitasking is one of those kind of qualities that mostly everybody needs to have. And then my motto for life is always do unto others what you want done unto you. So treat the people with the same respect that you would want to be treated with. Especially in healthcare, healthcare can be a high stress environment. So just always treat your coworkers, your residents, their families the way that you would want to be treated, the way that you would want your family to be treated. So I just added some pictures there. So down in the left-hand corner, that is where my camper sits on the Miramichi. The middle picture is of my daughter, and then the last picture is actually of me and one of our residents that we have here that was part of one of my rehabilitation programs. All right, so career portfolio. So like Deneen said, I have actually been with Shannex for 8.5 years now. I actually originally started as a PSW at Shannex. So I worked as a PSW for 1.5 years while I was taking my schooling for my LPN. Once I graduated from my LPN, I began on the floor as a floor LPN working shift work, days, weekends, nights, that type of thing. After that, I did go into the restorative role, or also the rehab department, is what a lot of people refer to it as. And I worked in that for 3.5 years. I'm actually currently in a temp 1-year position as the work and learn educator for the Fredericton region, which has to do with our students that come in through co-op placements, internal PSW programs, and colleges. So, like I said, I've been in the role for 9 months, but restorative for 3.5 years prior to that. So, a lot of my presentation today will be on the restorative role, just because that's what I have done for most of the chunk of my career here. But if you guys have any questions on any of the other stuff too, I am definitely open to questions about that. So I've always had a passion for geriatric care as well as rehabilitation care. Our company, Shannex, it values residents first. And I love the way we work with residents. We work with their families to develop individualized care plans because no one person is the same. We're all individuals, and at our organization, we really promote that. Previously, I have worked at a couple different nursing homes within New Brunswick and the Fredericton region, as well as at the DEC. All were amazing care facilities. It just so happens that, like I said, I love geriatric nursing. The hospital wasn't for me, and this is where I kind of have a passion for. So, positives and negatives of this career. So, I love the geriatric population. I love seeing them smile and being an advocate to ensure that they have the best care provided. When I come into work, I always say, we're kind of like our residents' second family. They always have their own family that, comes in and visits, but we're with them a lot. So I treat them the same way I would treat my grandparents or my parents if they were in here. The most rewarding part of my job is getting to know them and giving them that good quality care. If I can put a smile on one person's face when I leave here, I've done something good with my day. The one negative about this job is, getting close to your residents, getting close to their families, and seeing them pass away. While that is a negative, it's also very comforting to know that, you gave them the best care possible while they were here, and you made that time as comforting as possible. So it is a negative, but it's also a blessing to be able to be there during someone's final moments. So skills, I'm organized. Like I said earlier, I'm a multitasker. My core responsibilities are making sure that the residents receive the best rehabilitation care possible. So this could fall in many different spectrums. We have kind of rehabilitation care for if somebody breaks a hip, if somebody breaks, their leg or something like that. But we also have just regular rehabilitation care where somebody comes in and we walk them every day just to maintain the abilities that they already have. And then as for relationships, so I am part of the Shannex team, but I'm actually self-directed. So there's only me and one other person that works in this department. So when I come in every day, I have my list of things to do. I make appointments with extramural, but I also work closely with the interdisciplinary team on the floor. I couldn't do my job without them, without their feedback or anything like that. Looking back on my career, the opportunities are endless when it comes to the nursing field. There are so many courses and education opportunities when you get into healthcare. And looking back, I kind of wish I wouldn't have been afraid to try new things earlier on. So when I first started as a floor LPN, I was very set in, this is my scope, this is what I need to do, just trying to get that career under my belt. But I do wish I would have jumped on new opportunities earlier on. And as for career paths with nursing, be prepared for shift work. Most people start as a floor nurse, so that does include, days, evenings, weekends, nights, holidays, that type of thing. Healthcare is a 24-hour operation. But the more education you guys have, the more opportunities that will surface. There's so many courses that can be taken additionally to nursing, whether it's your OR course, foot care course. There's so many extras that are offered for this type of career. Be prepared to work shift work at first. We've all done it. That's usually where everybody starts. But nursing is the most rewarding job ever. When I leave here, I know it made a difference in somebody's life. And work placements are available. So we accept students, even if it's high school students, through co-ops, programs, things like that. We accept students through colleges, universities for placements. So we're welcome to, any education opportunity that we can help with within our community. And education and training. So I did take my LPN diploma at MBCC here in Fredericton. That did take me 2 years to complete. Like I said, after college, I did start working as a floor LPN. I worked at Shannex the entire time throughout my schooling as well as a PSW. Um, as soon as I graduated, I did take casual employment at a few different locations, which included Shannex. But as you guys can see, I did end up residing here. I can continue to do yearly education through Shannex as well as personal development education when it arises. So we're required to have our CPR training yearly as well as all of our online modules, which include infection control, policies and procedures, fire safety, everything that's pertinent to our building specifically, as well as any other additional courses that are offered. We always have extra ones during the year, such as wound care, palliative. We just had a really good mental health course offered to our internal employees. So I graduated in 2017 from my LPN. So I took that from 2015 to 2017. And then I have taken additional courses since then. So one of the main ones I actually teach within our facility is GPA. So this is a course on dementia care. So it's called Gentle Persuasion Approach. So this is a course that focuses, it's a full 8-hour day on dementia. How do we really treat these residents fairly? How do we get to know their history when they do have memory loss? And how can we incorporate their history into the person they are today so we don't lose sight of them and who they used to be? So it's an amazing course. So I do teach that one here. BLS, which is basic life saving, first aid and CPR. I also have my skin management course. So this was a course that was offered with Dr. LeBlanc through Ottawa. So part of the Shannex facility, we have different wound care leads throughout the whole province. It's a great course, but it's also great to have other people that are trained because we can kind of bounce ideas off each other if something's not working to heal a wound. I also have my back and form course. So this is through WorkSafe New Brunswick. This was a very, very good course. It was 11 days, but it was how to properly do body mechanics, how to teach people how to use their bodies properly. Healthcare is a big, big risk factor for developing musculoskeletal injury. So it's how do we prevent that, and how do we prevent injuries for us and for the residents. The rehab course also, so this is offered through the association of the LPN. So it is in partner with Beacon Health, and that is a rehab course, which is kind of how I ended up here. It's offered, I think, twice a year to all LPNs. You obviously have to pay to take it, but it's a great course, offers great opportunity to advance in your career. And then lastly, I am currently in the process of taking my certificate of adult education through Dalhousie University. I'm going to be done next year, but this is how to educate adults. I do a lot of teaching within Shannex, whether it's with PSWs, RNs, LPNs, but it's basically just to help me advance more within my career. A certificate of adult education is great to know that you're teaching people properly and how to evaluate them properly and make sure they're meeting kind of the objectives that we set in place. So work experience as a rehabilitation LPN, my daily tasks include I am the liaison between extramural, OT, PT, and SLP. So for those who don't know what these kind of 3 careers are, so our OTs are our occupational therapists. They are the ones that come in and they assess our residents for mobility needs. So whether it's a wheelchair, whether it's a walker, beds, things like that. Our PT is our physiotherapist. So they're the ones that if somebody comes in, let's say they have a hip fracture, they need help with walking, our PT will originally come in and assess them. And then they will give us the exercises to continue with them, which falls into the rehab department. And then SLP is speech language pathology. So if we have somebody that, is having a difficult time chewing or even difficult time speaking, we can get SLP to come in, do an assessment on them, see if there's anything that we can do to aid with that. And then I'm also responsible for any equipment maintenance, such as sling inspections, lift inspections, walkers, and wheelchairs. So in our nursing homes, we have a lot of mobility devices that we use, and we need to make sure they're in proper functioning and that they're not broken. So these general inspections are kind of a daily occurrence. I also assess residents' mobility status on an ongoing basis and make changes when the need arises. Our residents have good days, our residents have bad days. And sometimes our residents change, so we always need to be assessing their mobility to make sure that we're being safe, but we're also being safe for them so that nobody gets injured. I'm also responsible for temporary seating when a resident is admitted to our nursing homes until they can be assessed by OT. So a lot of times, we get residents from the hospital, they come to us as their home, and they don't have a wheelchair or a walker or something that belongs to them. So I do provide them with that until the occupational therapist can come in and get them their own equipment. And lastly, one of my daily tasks includes I'm responsible for the walking program, group exercise programs, and one-on-one physiotherapy. So that's just a very broad overview of my daily tasks. And then I also have some other tasks that aren't daily, but they usually occur either once a month, weekly, just depending on what the task is. So I am included in a part of wound care from assessments and dressing to restorative intervention. So if we have somebody that comes in with a wound or somebody that develops one, I do have my wound care course. So we assess them, we do what we think is best for it. And if it's somebody that needs, an air mattress or something like that, that falls on my department. I also sit in on yearly care conferences with families and other disciplines. So here at Shannex, it's very important to us that the families are always kept in the loop. Of course, if something changes or something happens within that 1 year time frame, we're in constant communication with them. We call them, but we also find it very important to actually sit down once a year with the family so that the families can see the faces of every discipline that they're dealing with here. We have nursing, we have administration, we have rehab. So we think it's very, very important for them to know our faces, not just our voices when we call them on the phone. But it's a good time to sit down, go over everything to do with the residents, see if anything's changed or if the families have any questions. And lastly, I participate in a multitude of other things, such as new hire orientation. So whenever we get new hires here, they need trained on their equipment that we have, our lifts and things like that. So that falls within our department. We're also responsible for ongoing injury prevention for staff. So the back and form course that I said, the staff need to do it once a year, just as a refresher of, keep your back straight, bend at your knees, not your hips, that type of thing to prevent us from any musculoskeletal injuries. We also have a risk management team that meets once a week. So this is where we discuss, if we noticed a resident's not eating as much the past week, is there a reason? If somebody's falling, has anything changed? So it's where we really assessed all 60 residents in our nursing home, and we see if there's a solution that we can come up with ongoing. And lastly, I sit on the Joint Occupational Health and Safety Committee. So that is a meeting that we have once a month where we talk about the building. So anything in the building, if stairwells or anything like that are cluttered, basically any risks that are in the building, we assess and try to find a way to rectify them. So I did include an article here. I know healthcare is very, very well known, but I feel like a lot of times we talk about the nursing portion of healthcare. So I just included an article here. It's on the Shannex Facebook page. It's on our shannex.com page. But if you guys ever wanted to go read up about the actual rehab department themselves, there is kind of a success story there about one of our residents at Neil Hall and her rehabilitation journey. And the last thing I have today is career advice. So in conclusion, my advice for you guys would be to find a job that you have a love and passion for. Going into a job that you truly love every day makes a difference, and your days will fly by that much quicker. And when opportunities present themselves, always say yes. If nursing is the path you're looking to go down, make sure to ask questions. Just like at the end today, if you guys have any questions, ask, please. Also, give yourself grace. Everybody started somewhere. If you start nursing or any career really, and you've made a mistake, we're all human. We all make mistakes. Give yourself grace. You can only learn and move forward from that and be open to new opportunities. With a nursing career, the options are endless, and nursing isn't an easy path, but it's a fulfilling one. Every day in nursing, you guys have the ability to touch a life, and sometimes they'll touch yours. So if you guys have any questions, I'm going to turn it back over to you guys.
Awesome. Thank you so much, Morgan. That was lovely. I know we have our beautiful Miss McDonald here, her online student. She has 47 healthcare 11-0 students
Oh,
that will be watching this. And Kim, I'm not sure if you have any questions, but I have a couple questions as always. So one of the roles that you spoke about was constantly assessing your patients and I shouldn't say patients, your residents and the family that you have at Shannex. And is that something that made you nervous when you first started? How things can change very quickly, and especially when it comes to somebody's health. Is that something that you were taught on how to triage and all those kinds of things?
so I will say when our residents come to us, we do get a pretty good picture before they come to us, whether it's from the hospital or wherever they're coming from. But it is a hard discussion to have, especially if you have somebody that, used to walk with a walker and they've had falls and they've declined. It's never an easy discussion whatsoever. I have gotten more comfortable with it as time goes on, but I find one of the biggest things with the families is if you call and you're honest and you have, the information that you can provide with them, 99.9% of the time it's a pretty good conversation at the end of it. But I find here too, we're in constant communication with the family, so it's never a shock when we call. Generally, if somebody is declining or kind of their needs have changed, there has already been, 4 to 5 phone calls throughout the course of a week to let them know that things are occurring. So it's never, a huge shock to the family if something does happen. I hope that answered your question.
Yeah, absolutely. And that kind of leads to my next question. Do you folks have check-ins with families or only when things are declining? I'm assuming that you would have like a weekly check-in, or what does that look like for families?
Yeah, so that yearly care conference that I spoke about, so we do them minimum once a year. And that's just really to sit down and even if, nothing is wrong, we just meet. It's nice to see the faces of the people that are calling you all the time. We always call the family when anything changes, but we also have a lot of times when the families are in, they'll come to the nursing desk and ask a question. We're always open to questions. Our phone lines are always open. The families here know that if they have a question, they can also just pick up the phone and call. They have all of our numbers. They're posted in the residents' bedrooms. They're posted at the nursing stations, at the entrance. So we have pretty open lines of communication here, which is good.
So I would say one of the biggest traits that you need to work in a long-term care home is to be able to have conversations with many different people,
Yeah.
understanding that everybody has different personalities, and also understanding that sometimes when some folks get upset, they're really just caring about their loved one, and it's so important to validate that and empathize and understand that you are taking care of their loved one in their home because a long-term care home is their home. Yeah.
100%. And that's kind of the quote we use is, they don't live where we work where they live.
Oh, I love
So
that.
it's their home, right? So a lot of times we're asked by the families, like, do you guys have any restrictions? Do you have visiting hours? We don't. It's their home, right?
Yes.
So open lines of communication are very important. And I always say if a family is giving you a hard time, they're generally having a hard time. It's never easy to have to put your loved one in a nursing home. So everybody's going through something that we generally don't see from the outside.
Yeah, exactly.
Yeah.
Miss McDonald, I don't know if you have any questions, but you're more than welcome to pipe in. Um,
I'm good, thank you.
okay, well, thank
Thank
you
you,
so much
Morgan, that was
for
great.
Thank you. And I'm going to put the post-activity assessment rate in the chat for you to fill out as well as a teacher. But one thing I really want to say is thank you to Morgan for the time and energy you placed into your presentation. You can tell that you're very passionate about your work, but you also have a wealth of knowledge. And I know that I'll probably be reaching out with more questions. But also when we have students that want to maybe explore the rules that you spoke about. And this is what's so lovely about the partnership with Shannex and with my other partners is that sometimes students feel like they need to do a whole co-op position to understand if that's something that they want to do. And really speaking to a professional that's doing the job that maybe you're exploring is it may be a better option if you don't have 3 months to do a co-op because you can really get to know what that role looks like, and get a feel for, I don't think there's ever a typical day in a long-term care home, but what that may entail. And that's really what's so important when you're choosing a career. And I do know that within health and social care, it's really important to have certain traits and qualities of caring for others. So you spoke about that so beautifully, and now I want to come work at Shannex. So with that said, thank you so much from the Center of Excellence for Health. And for folks that are watching online, we have 2 more sessions tomorrow and 1 on Friday. We're not done. So have a beautiful day. Enjoy your Valentine's. Make sure you get outside, take a deep breath, and enjoy all the love in the air. Signing off.
Thanks, guys.
Thank you.
And the